Spotting in early pregnancy. When to worry and when to relax. You just found out you're pregnant, but suddenly, you notice a few drops of blood. Your heart races. Am I losing my baby? I know how terrifying that moment can be. But here's the truth. Spotting in the first trimester doesn't always mean something's wrong. In fact, many women experience it and still go on to have completely healthy pregnancies. In today's video, I'll explain exactly what causes spotting, when to relax, and when it's time to call your doctor. Spotting simply means light bleeding, just a few drops of pink, brown, or dark red blood. It's very different from a full period. This can happen at any stage, but it's most common during the first trimester, the first 12 weeks of pregnancy, and depending on the cause, it may be harmless or an early warning sign that needs attention. Section 1. Common and harmless causes. Air implantation bleeding. Around 10 to 14 days after conception, the fertilized egg attaches to the wall of the uterus. This can cause mild spotting, usually light pink or brown, lasting just a few hours or days. It's one of the earliest signs of pregnancy. Air cervical sensitivity. In early pregnancy, your cervix becomes softer and filled with blood vessels. A simple pelvic exam or intercourse can irritate it slightly, causing spotting, especially if you notice light pink discharge afterward. Air hormonal changes. Your hormones are adjusting rapidly to support the pregnancy. Fluctuations in estrogen or progesterone can sometimes trigger minor bleeding. A subchorionic hemorrhage. Sometimes, a small pocket of blood forms between the uterine wall and the gestational sac. Your doctor may see it on ultrasound. It often resolves naturally, but requires monitoring. Section 2. When spotting might be a warning. Not all spotting is innocent. There are times when it's the body's way of signaling distress. 1. Threatened miscarriage. Spotting may progress to heavier bleeding with cramps or back pain. Sometimes it resolves, but it may also lead to pregnancy loss, so early evaluation is crucial. 2. Ectopic pregnancy. This happens when the embryo implants outside the uterus, usually in the fallopian tube. It's a medical emergency. Warning signs include sharp one-sided pain, shoulder pain, dizziness, or fainting. 3. Molar pregnancy. A rare condition where abnormal tissue grows instead of a normal embryo. May cause brown spotting, severe nausea, or unusually high HCG levels. Section 3. What to do if you notice spotting. Here's what you should do if you notice spotting in early pregnancy. 1. Stay calm, but don't ignore it. 2. Note the color, quantity, and duration. 3. Avoid sex, exercise, or lifting heavy items until you see your doctor. 4. Contact your healthcare provider immediately if the bleeding becomes heavy, you see clots or tissue, you have cramps, dizziness, or fainting spells. Your doctor might perform a pelvic exam, ultrasound to check fetal heartbeat, blood tests for HCG or progesterone levels. Here's some comfort. About 1 in 4 pregnant women experience spotting in early pregnancy. Most go on to have perfectly healthy babies. So, don't panic. Rest, hydrate, and follow up closely with your healthcare provider. Pregnancy is a journey, sometimes unpredictable, but with timely care, knowledge, and support, you and your baby can thrive. If this video helped calm your fears, give it a thumbs up and share it with another mom-to-be. Subscribe to My Health by Dr. J for more pregnancy and women's health insights every week. Remember, stay informed, stay calm, and stay healthy.
If you find this video helpful, like, subscribe or follow My Health by Dr. J for more important health videos.